Hello, everyone. Welcome to our conversation. After the pandemic, healthcare in crisis. I'm Dale Willman. I've worked as a journalist, photographer, and media trainer for a number of decades. The work has included stints at NPR, CNN, CBS, and other news outlets. I'm going to ask for a quick nod from everybody if you can hear me coming through, okay? Yay, good. I now run the Resilience Media Project at the Earth Institute of Columbia University. Our program works to educate journalists and other media professionals on the science of resilience. And as everyone, because of the pandemic, we've pivoted the program and we're trying to bring journalists information that will help them as they cover all the facets of the current crisis. Among those issues are the issue of healthcare. Around the world, healthcare systems are fracturing. It's not just an overload of patients, it's also how healthcare is provided, how people are treated, and who is treated, and often the lack of political will to prioritize healthcare needs. We're going to be discussing healthcare today, but mostly with a broad brush rather than with a granular look at systems collapse. And I hope we'll end with suggestions of how our systems can be built back in a way that is more inclusive and accessible for everyone. First, if I could introduce our guests, I'm excited to have them with us today. Dr. Cheryl Holder has dedicated her life to serving populations that too often go without. Her work assesses the impact of social determinants of overall health on health outcomes. And as she'll discuss, the science shows that those social determinants play the largest role in those outcomes. She was a TED Med 2020 presenter. Be sure to look for her talk entitled Clinicians for Climate Action. It should be up on the web soon. Mustafa Santiago Ali is a wonderful speaker whose views come from a wealth of knowledge and a diverse career. Mustafa spent more than 2 decades working for the EPA before moving to the Hip Hop Caucus. He now serves as the Vice President of Environmental Justice, Climate, and Community Revitalization for the National Wildlife Federation. I look forward to hearing a bit about the connections between justice, climate, and revitalization. Also with us is Mary Heglar. Mary is a climate justice essayist and writer in residence at the Earth Institute. Her writings on Medium have sparked some amazing conversations, and they underline how climate change disproportionately affects people of color. She also pushes for a more inclusive response to climate change. Some of her views may surprise you. Be sure to read her work. Oh, and in her day job, she's the Director of Publications for the Natural Resources Defense Council. Before we begin, a few housekeeping notes. I have the comments function on Zoom turned off. I find it kind of difficult to follow to have all those comments scrolling by. So instead of taking questions in that way, we're using a web portal. So get a piece of paper so you can write this down. During these internet conversations, the best questions are often lost as they scroll off the screen. So point your browser to onlinequestions.org. That's onlinequestions.org. And once there, you're going to need this code. The code is 407-2020. Again, it's onlinequestions.org, and the code is 407-2020. You put that code in the box that asks for the event number, and you hit enter. When you do that, you're on the page that allows you to write questions. But here's the part I like about it. If you see a question that you particularly like, you can like that question instead of writing your own. And the questions with the most votes will rise to the top, and those will likely be among those receiving answers. So the voting is really important. If you see something that you think is of particular interest, a question that you want to hear answered, be sure and like that question. Also, the first questions will go to the journalists that are watching this. So if you are a journalist, please start your question with the word journalist. Those questions will be given priority, at least at first. It's an honor system here, so please make sure you're a journalist if you add that. We hope to get to as many questions as we can, though. Finally, once this event is recorded and edited, it will appear on the Earth Institute blog, State of the Planet. The post will also include links to resources of value to journalists, and we'll be offering a number of story ideas that you can work on immediately. And hopefully we'll talk about a couple of those today. So let's begin. I promised a broad brush look, but before we get there, we need to establish a baseline for the conversation. So Dr. Holder, could you please give a description of the state of healthcare in the US before the pandemic?
Good morning, everyone, and thank you for being on this webinar for this important time in our lives. US healthcare, as most people understand, is a public-private partnership with most of the employed or health insurance model goes for employed. workers in large companies. And with the Obamacare expansion, we were able to get it in many states to smaller companies, and with Medicaid expansion in folks who had no insurance or had no ability to purchase insurance. So that model leads us to a very fractured way of delivering care, because that still leaves a large percentage uninsured, and especially in states that did not expand Medicaid, the poor adult population is vulnerable to all the health effects. So based on a structure where if you're richer employed, you'll have access to health care. If you have some small businesses and some resources, you'll have some modicum of health care, which is not bad through the Obamacare policies. If you're lucky enough to be in a state that expanded Medicaid to poor adults, you're getting good coverage. If you're a child, most than likely, most states have coverage unless you're undocumented. So in southern states, like I'm in Florida, a large swath of the low income who were based on the Medicaid guidelines would never qualify for any health insurance. So a large swath of the southern states have a large number of uninsured. That brings us to the race issue, which is this huge black-white variation in healthcare. Who gets insured, who gets expanded Medicaid, and who has all the ill effects of living in poverty, lack of access to good quality education, lack of access to quality food, lack of access to preventive measures, and that leaves the brunt of the poverty and the issues on the poorest in the pretty much the most marginalized communities, which many of the African-American folks in the South represent. So we see the brunt of what happens. So that leads us to the response that we're seeing now with COVID.
Can we, and I'm looking to find Mustafa up on here. So he may be having difficulty joining us, so I'm going to keep looking for him. But in the meantime, can you expand a little bit more about what the pandemic has done? So we have this health system that's in this fragile state to begin with, and what we've seen occur from the oh, I think I see him now. Great. What we glad to have you joining us. What we see now is a system that has become quite brittle, and that has collapsed in many ways. Can you talk about what the pandemic has done to the system you described, domestically first, then internationally as well?
Well, in the US, with our hospital systems often being controlled by different insurance companies and not a universal system. So the purchasing decisions, the bed decisions, the ventilator decisions are based on what they would expect for an insured population coming into your health system. And it's based on the seasonality of certain situations. Flu season gets the most time that you might need beds. So the supply system in our current hospitals, which are very, very tight, very much built because we have all this technology, we can now track how many masks we're going to need in January, how many masks we're going to need for December. So if that's built on a system that's based on insured, based on the general population that's going to pay, and not recognizing the disparities that we've already had, when there's a surge in the population at the time where these health systems be tightly budgeted and controlled, there will never be an adequate response. And the population that is most vulnerable for this infection are already sick. If their premorbid condition made them much more vulnerable. So the severity of disease in this population is going to be higher. So when you look at what happened to the US system, it is expected that you would have a surge of patients. Who builds a hospital to expect 4,000 people to show up, and a good 5% or 3% is going to be severely ill to be in ICU. So that is a system that is not universal, is based on the profit motive, whether you're nonprofit or not, but there is a profit motive to continue operation of your organization. So there will never be a lot of masks for physicians because the supply chain mechanism has the calculation based on last year's flu epidemic. So this does everything that happened that's not working in the system. The pandemic has brought it out that there has to be a much more universal evaluation of how we deliver health to the citizens and our communities. We're going to be equal across the board.
And Cheryl, as an audio guy, I'm a stickler for audio. Your microphone is cutting in and out a bit, so if you can be careful where your microphone is, that would be helpful. I don't know if you're using headsets or not, but just I want to make sure we can hear everything
right.
clearly.
I should have used the headset. I'm using just the phone. So I will, while you talk with Mustafa, I'll go get my headset.
Wonderful, thank you.
Thank you.
Mustafa Ali, so happy to see you. I love the backdrop there. Access to healthcare is not a racial issue, it's a human issue, but the pandemic has made quite apparent that there is a racial component in healthcare. Blacks and Hispanics are dying disproportionately from virus-related problems. The numbers are depressing. In Chicago, 70% of those who have died are Black, but the city's Black population is just 29%. In Milwaukee, as of Monday, 33 of the 45 residents who have died were Black. That's a 73% rate in a county that is 28% Black. These are troubling numbers. Statewide, the numbers in Wisconsin are much worse. Can you talk about that a bit and that component of this?
Sure. You know, lack of access to healthcare actually is a racial issue, and it's because we've made it one. Now, we know that we have 80 million people who are uninsured and underinsured. A number of folks in that space have been sharing with us that the capacity for folks to be able to actually access medical care, we won't even get into the medical biases yet, was a real concern. We also know that we have medically underserved areas. And if you look at who primarily lives in those areas, it is communities of color, it is lower wealth communities, and sometimes that is lower wealth white communities, and it is also indigenous peoples. So if we know that these are the folks who are living in these medically underserved areas, then we should be having a particular focus on making sure that we are addressing what's going on there, because we now see that when we're dealing with medically underserved areas, when we're dealing with these physician deserts, it makes it much more difficult for those who are being impacted from the virus to actually be able to, one, get to a doctor, to get diagnosed, to then actually be able to get tested. So all of that kind of moves into this mix of creating these disproportionate impacts that continue to happen inside of our most vulnerable communities. My family actually, unfortunately, and I wouldn't want to see anyone lose any additional lives, we were the first to have someone who died in West Virginia, in Appalachia. It was a woman of color who also had challenges in being able to, access the medical healthcare system. The reason that I also say that we have to be particularly focused on these communities, and you raised many of the statistics that are out there. We also know in Michigan, 40% of the folks who have lost their lives have been African American. In Louisiana, 70% of the folks, and of course those numbers fluctuate on a daily basis, but it shows us that there are certain groups of people whom we have to be focused on. We have to make sure that the right types of testing is going on and they have access to that. And we'll unpack today all the various things that make that much more difficult. But let's anchor this in the reality of what's actually going on and that people have been raising for years. And that is the fact that communities of color have all these chronic medical conditions. And it is not just a magical thing that has happened. It's not a genetic thing that has happened. There are exposures that have been going on for decades that, for whatever reason, many did not want to pay attention to. We know that 100 to 200,000 people are dying prematurely from air pollution every year. Millions of people are also having their health impacted, and that is making folks more vulnerable to COVID-19 because we have these cancer clusters. We have liver and kidney disease. We have heart diseases. And we also know that we have all these various lung diseases, everything from asthma to bronchitis to tuberculosis and a number of other things. All of this plays into these medical disparities that are happening that are linked to other impacts that are driving these numbers.
And it's ironic, of course, that the pandemic has led to a drastic drop in industrial output, which has meant a huge drop in pollution. I think I saw figures of 40% for some pollutants in China, for instance, when they shut down factories there. And that means that lives are going to be saved or extended because of the reduced exposure to these levels of pollution. So I want to talk about social factors too, but let's get a little bit more into these chronic issues. One of the huge ones is particulate matter, air pollution, PM 2.5 for the health journalists. They know what that means. It's particulate matter. I guess it's 2.5 microns and smaller. These are small little things that can get into your lungs. They can carry other toxics and toxins with them. They embed there and they impede lung function. So people who live in polluted communities, who live near factories, spewing particles of various kinds, who live in areas where there are heavy transit corridors with trains and buses and other things spewing particulates from diesels particularly. That's something that leads to these chronic conditions as well. And the people living in these communities are these underserved that you're talking about.
Yeah, we know that about 90 environmental rules, statutes, regulations have been rolled back by our current administration, which is mind-boggling because we have the numbers associated with, just the basic levels when we had some protections in place. So, we got 24 million people, 25 million folks in our country who have asthma, 7 million kids. We know disproportionately it is African Americans and Latinx communities who are the ones who are going to the emergency rooms, the ones who are losing their lives prematurely. But now we overlay that with COVID-19 and understanding we've got all of these folks who are dealing with these types of conditions. It makes no sense whatsoever for the Environmental Protection Agency to stop enforcing environmental laws. We know that over the past 3 years, they've been trying to roll back everything in the air, water, and land context. When we saw the actions around the Clean Car Rule, which, goes to what you were just mentioning around PM 2.5, that they're going to put more pollution into these communities that is going to exacerbate health conditions and are going to make folks more vulnerable to COVID-19 if it's still going on as these actions are happening. But for us also to be forward thinking. If you look at the IPCC report, if you look at the National Climate Assessment Report, an area that didn't get as much attention but should now is the reference to infectious diseases. Whether those infectious diseases are coming from vectors or they're coming from other pathways, we know that we have to get prepared for these additional challenges that climate change is going to bring and the different impacts that are going to happen inside of these communities. We know that when you start to, pull away from the Paris Climate Accord, when you go against some of the other air-related laws and statutes that, people have been working on for decades, trying to get the basic protections in place, and you begin to weaken those, you are culpable in the lives that are being lost because you know the basic numbers. EPA has actually put out to the public on many of these that they've rolled out the additional lives that are going to be lost. It's never highlighted, but they do say that things are not going to be, everyone knows you're not going to be as protective as many of the things that the Obama administration and previous administrations put in place. So we know we're going to have more air pollution. We know that there's going to be more water pollution as well. And we also know now that is having these additional impacts on communities of color, on lower wealth communities also, which is important for us to talk about what's happening in Appalachia, what's happening in the Rust Belt, what's happening on the Gulf Coast to working class and lower income class white folks as well. Because if folks think this is just a people of color issue, they will put it in the box that they usually do. But when folks know that everyone can be impacted, then sometimes you have more of a concentrated effort to address what's going on.
I'm glad you raised
pick up on that.
Please.
What Mustafa talked about, the particulate matter, the interest. The Harvard Research Group just published their data, and this is not racially based. It's just a 1% increase in the particulate matter 2.5 or bigger on the 2.5 particulate matter. There was a 15% increase in the COVID death rate. And they adjusted for obesity, for smoking, for all the things that you hear about. That was adjusted for and just a 1% increase. So again, some of the COVID-related deaths that we're seeing in the poorer populations, especially for Blacks, we know by the data, Blacks tend to live closer to highways, closer to air polluted areas, in the bigger cities, with worse air quality. And the chronic damage that this has probably done to the lungs with COVID-19 has participated in increasing their death rate. It is not solely because they're overweight and diabetic, but there is a role that being close to the pollution has been proven to impact the death rates in COVID.
And I want to get to Mary about this in a second, because this is an important distinction, I think, to be made, that we often, Dr. Holder, you and I talked earlier today about smoking, and this is, there are all these factors that people talk about, and it seems to be an effort to shift blame. Well, smoking is a huge cause. Well, that's a personal issue, and that's a personal choice you made. So it's actually your fault that your lungs are compromised and that you're getting COVID and suffering severely because of it. And this idea of shifting blame to make it a personal decision rather than the only affordable access to housing is next to these roads. I'm fascinated at how many schools are sited right next to really, really busy highways, and kids go out in the playgrounds right next to the interstate. We have that in my own community here. So that's an interesting aspect. Mustafa, the idea of the EPA, I'm glad you mentioned the rollbacks. It gives me a chance to mention that I'm working with Society of Environmental Journalists. We hope to have a webinar soon to talk about that and the effects. And for the journalists, I see many of my friends online here. I hope that you'll be looking at that as a very good story idea for those of you working domestically. So Mary, you've written that climate change isn't racist, that people are. So that's a really provocative essay that you wrote, and I'm really curious if you could say the same thing about the healthcare system.
Yeah, maybe this is one of my surprising views, but absolutely not. The healthcare system is definitely racist. The healthcare system, just like any other American institution, is full of institutional racism. It's beset with it. It's built on racism, from medical experiments that were performed on slaves to the literal theft of Henrietta Lacks cells. And it plays out today in all of the ways that Cheryl and Mustafa have already laid out. But if I could add a few, it would be the infant mortality of Black children, as well as Black mothers being more and more likely to die in childbirth. And also the fact that healthcare is just so expensive and health insurance is so inaccessible for so many people who happen to be people of color, and that hospitals and communities of color tend to be under-resourced and understaffed and overcrowded. But I think probably the analogy for climate in this case would be Corona. So Corona is not racist, no, but the healthcare institutions are. And Corona is going to be playing out against that backdrop, as well as the backdrop of environmental racism, which Mustafa already laid out so eloquently.
Either of you want to pick up on that?
Yeah, the Institute of Medicine has done many research back in the early 2000s that has proven that racism exists in medicine. And they made a clear point that all institutions should no longer pursue the proof that they're not racist and to accept that it's a basic bias within our health systems. And we should now be much more aware of it. And how can we then address racism? Because there's implicit bias. And that's one of our concerns as the physicians organization, knowing the reality of implicit bias, that in general for all racial groups, Black is often perceived in a way first. Just the decision who gets a ventilator and who doesn't get a ventilator, who gets hydroxychloroquine if it's proven and who doesn't get it. These are all the things that we know are subject in the COVID arena to be biased and may be impacted by racism. But it's been proven through Institute of Medicine that racism is part of what happens in America. And now our role should be, what role do we each as physicians, white, Black, whichever color, accept this fact, and then try and address the issues? So much of what's happened to Black people, it comes from hundreds of years of institutionalized racism and the continuation of who gets access to care. Is it a surprise that the states that did not expand Medicaid tend to be below the Mason-Dixon line? I don't think that's a surprise. So how are we as just citizens in this country, as the US Americans, going to address the racism? Because it's real and here, and it's been proven hundreds of times over.
I see a lot of international friends online with this too, and I want to broaden this to an international discussion too. But I want, before we leave this point, I'd like to ask if any of you have, and I'm putting you on the spot, and you may not, but if you have a story idea, an entry point for a journalist that they might be able to, a study they can use to investigate this, some numbers, a particular project that you think is addressing this or working on this issue.
Well, I think there are a number of opportunities for stories. Some have kind of been touched on a little bit on the edges. There has not yet been enough reporting about what's going on Indigenous lands. For those of you who've spent any time on the res, you understand that there is very limited infrastructure. There is a beautiful culture there. There is great folks who are living there, but the resources and the infrastructure have never been in place to properly embrace humanity or to make sure that people are protected. So I would say that there needs to be additional focus that's there. Folks need to also focus on our farm workers and really understand the impacts that they've been going through for years now, both documented and undocumented. We see how the stimulus bills had no particular focus or attention on that population. If you spend any time in the fields with folks, and folks know I've worked with almost 1,000 communities now, both in this country and outside the country. You will see folks who are dealing with the exposures from pesticides who have also impacted, their health, lower their immune systems, created all these breathing difficulties, and yet they still are expected to be out in the fields working at this time without any safety net underneath of them. The stimulus bill moved money to the owners of farms, but it did not focus on the workers who are on those farms, their access to clean water, their access to addressing the medical needs that exist in that space is another area that we need to focus on. And then people are finally beginning to pay a little bit of attention to the additional sets of frontline workers, all of those folks who are driving the buses and the subway cars and all of the various people who are being, in contact with folks on a daily basis, who are also, in very challenging situations, is another story from the health side, from the wealth inequality side, and from the systemic racism side.
Yeah.
Mary, Dr. Holder? Yep.
Yeah, just based on even the response, I hope somebody will elucidate it a little bit more when we look at the equity lens involved. In South Florida, and most of the CDC criteria required testing at 65 and older was pretty much you can go through. When you look at what the data shows for the poor Black population, our 65 and older is only 14% of the population. Blacks in general don't live as long past 65. So the testing guidelines right there prioritizing to that group meant that I got phone calls from people who were asking me how could they get tested. They're single moms in their 40s, 50s, who felt like they had symptoms. But at the time when the early testing guidelines, it was for a part of our population that does not meet the criteria. When they instituted the testing sites in my community, a very large area called Little Haiti and other areas where the Haitian concentration, there were no testing sites. You had to drive. If you look again at the social determinants, and this is why we ask for the social determinants to be evaluated in your decision-making. How many folks who are poor have access to a car to go do drive-through testing? Not many, especially in some communities. In our center in the Fort Cane Belt in the central part of Florida, there were no testing sites there for a lot of the farm workers. So the approach to testing may end up costing more for some populations because we as Black physicians, we've been advocating bring the immediate testing, the rapid testing to our communities. Because You cannot send somebody home to shelter at home when there are 4 or 5 other multi-generational folks in their homes. They don't, the data is clear on how Black and poor people live. I can't go shelter at home like I see Chris Cuomo, where he's in one part of his house and the rest of the family's in another part of the house. In most Black communities, it's one bathroom and everybody's in together. So we need rapid turnaround so we know this is high. When you go home to shelter in place, somebody comes with that family, or else you're going to have more. So this is when you use an equity lens, you're using resources that addresses the need and not look at whether Black or white, but we're asking use equity and say this population requires a tweaking the response a little bit more. We're asking for more testing units, rapid response testing, so that we can really track and contain it for a population that can't do traditional lovely shelter in place and can't even come up with $200 to go. So these are the issues that we say we want an equity lens address this, recognizing the problems that we've had in our communities.
And excuse me, the equity issue comes to access for information too. We're all sheltering in place, we're at home, and the majority of information is out there on the internet. And those who are well educated and well off tend to forget that there's a huge chunk of the population that doesn't have access to the internet. And it's not just people of color, it's even people with means, but who live out in rural areas where cable systems don't pass by. So there's a huge chunk of people still. It's interesting when you look at the statistics, they say, well, this many people have access to broadband service, which is high-speed service, and I think it's around 73% or something. But access isn't the same thing as having it. And that's something that we need to think about and to address as well, because this information need now is greater than ever.
Yeah, well, just real quickly, we should make sure that we also highlight the fact that there is a digital divide that exists inside of it, and that we have to be thinking critically about how we're going to address that digital divide. In many instances, that is folks of color and lower wealth communities who are being impacted by that. We're expecting children to learn online as schools, move in that direction as we're going through this pandemic. There are still huge swaths of the country where this creates a very serious problem. And then, of course, in our rural areas, the question around broadband and making sure that everybody has access, but also that everybody can actually afford it. If you look at some of the discussions that are going on in Capitol Hill, and I'm a part of a few of those, folks are often having a conversation about, the moratorium on utilities. And of course, broadband is a part of that. But in many instances, that is just pushing the problem down the road where people will have to deal with, this mounting debt that comes in that situation. So we should be focused on also advocating that, during this time that we are removing the debt that's associated with that, and for a period of time afterwards, to make sure that we're not creating an additional set of challenges once we make it past the pandemic.
So we'll put a lot of these questions up on the website once we get everything posted when we're done. Excuse me.
If I can add.
Yeah, please do.
Yeah, so I just want to add to this idea of an information deserts, because those tend to mirror healthcare deserts. And so not only is it that people don't have access to the internet, there's a lot of places where people don't have access to local journalism at all. And in order to track a disaster like this, you kind of need to know what's going on right around you. So in a lot of rural places, newspapers have closed up just as hospitals have dried up, which creates like a double problem, because how do you know where to go to get tested? It's definitely not in your community because there's no doctor in your community. And also following up on what Cheryl was saying, I live in the South Bronx, and I saw a couple of headlines saying that Bronx residents are twice as likely to die of coronavirus, which is largely because of the existing health crisis that was already here. But all of the testing sites for coronavirus are in the Northeast Bronx or in Manhattan. There's none in the South Bronx. And also, just like as far as story ideas are concerned, if you're going to talk about how Black people are more likely to die of coronavirus, I just want to caution that you have to talk about why. And why is because of all of these structural barriers that we've just talked about. In addition, I would love to see more stories about how coronavirus is already and is going to intersect with climate change impacts, because one disaster is not going on pause for the other. And the reason that people of color are at higher risk for both of those things is because of environmental racism. And if you're going to talk about it, you have to talk about that.
And why don't we make that pivot now? But first, let me mention the questions thing. We'll be taking questions in just a bit. So point your browser, if you haven't already, to onlinequestions.org. Once there, the code is 407-2020. 407-2020. Enter that code in the box that asks for the event number, and then hit enter, and that'll take you into the questions area. Please start asking your questions, because we'll get to those in a bit. So let's move this more broadly and make it more international as well. I dislike the phrase light at the end of the tunnel. And administration officials are saying that they can see the light. Eventually this pandemic will end, but the disparities in healthcare that we've been talking about and that have been brought out by this crisis will still exist. So what effect will climate change have on all this? And this becomes a broader question. This is an international question, and it's people across the world who don't have proper and appropriate access to healthcare. So what effect is climate change going to have? Mustafa, you want to go first? Cheryl?
Yeah, let's have Mustafa go first.
No, go ahead. Knock it out.
Sorry. Any one of you go.
Well,
Okay, sure.
Mary, right, Mary, you go.
Oh,
Sorry.
okay. I started. No, they said doctor.
No, you are the doctor. I think the doctor should go first. Go first.
Okay.
So I look at the fact that COVID being, when I do my talks a lot, I talk about canary in the coal mine and what things can do to wake you up and see what's going to happen for the future. And I think use this as an example of our first dress rehearsal of a run through, because we anticipate even more, because we know the increase in vector-borne diseases, which right now we're experiencing vector as the human being the vector. We're infecting ourselves and we're taking this virus to other humans. And when we often talk about climate change vectors, we often talk about the insect vectors. And nobody really brought human as part of the factor. And this has made us realize that one of the biggest and most dangerous vector will be the humans. And the underlying bringing us with the climate, bringing us closer to these sort of zoonotic, these sort of infections that are in the animal world. And as we get closer to the animal world, we anticipate this will happen. And we don't even know when the permafrost melts, what other vectors will be and infections or things will be released. And then how do we as a people deal with that? But some of the more immediate things I see with climate, since we know hurricanes are getting more intense, and this hurricane season has been predicted to be more because of the El Nino effect, we are now looking at going into hurricane season in 2 months in South Florida with a disease that we don't think is going to go away. How do you then respond with sheltering of a population when the hurricanes become category 4 or 5 across the coast? These are the intersection of an incoming pandemic with what climate change has already done to a hurricane season and a hurricane response. How do you then respond? Where do people who have the worst housing, worst shelter, which is often the poorer folks who will go to these huge municipal shelters with COVID? So we have to be awakened to all the impacts of climate change, because we're dealing with it now. It's not something 20 years from now. It is right now, because this hurricane season is our first time to deal with an infection when we know our hurricane response is going to be very much affected by the COVID pandemic. And it's going to be severe, more frequent storms in the severity that we anticipate.
And that's an interesting point, is the fact that we're looking at these each as discrete units. Well, there's climate change over here, there's pandemic here, but they're not. They cross each other and create this synergy that can make a much bigger problem.
So let me give y'all some real talk. Let me anchor it in the reality of what's actually going on on the ground and what we've seen. So let's go back to the time when Puerto Rico was hit by the hurricane. If you remember, there were folks who were struggling to actually have a drink of clean water. There were folks who were actually accessing Superfund sites to get water because they were so desperate in that moment. If you go to the Gulf Coast, go look at communities like the Manchester community in Houston, Texas, which is primarily a working class Latino community. When you go there, and many of you have heard me talk about this, and you roll your windows down in the car, you feel like you're breathing in gasoline fumes. This is an area that was hit by the hurricanes. And when the hurricanes came, huge amounts of pollution were released as the industries were doing their startup shutdown processing, and all that was pushed into the community. So imagine that a hurricane comes as we're dealing with this COVID situation, all that pollution goes in, more people then are impacted by their health, and the virus finds new places to be able to infect because you've got all these folks who now have decreased lung capacity and have these additional diseases that are popping up. Or you can go right down the coast to Port Arthur, Texas, where again, you know, for as far as the eye can see, are petrochemical corporations that are spewing things out that are warming up the planet and causing more of these storms. But it doesn't stop there. I want you to think about also the wildfires that keep coming because of these droughts that we're having. I know the president has a different narrative for why the wildfires are happening, but any intelligent person knows exactly why it's happening. And we know that a number of the folks who are part of our first responder crew, so you have those folks who are full-time firefighters, part-time firefighters, volunteer firefighters, but we also have a huge population that comes from the prisons. We know that we have a problem with COVID-19 in the prisons, but they're just not testing at the levels they need to. So now you have all of these men and women who are out fighting these firefighters that, these fires because of the impacts that are happening from the climate emergency. And all of them are now in close quarters. You're supposed to have PPE, but you're out there and it's 100+ degrees. So you have to figure out a way to actually be able to breathe, to be able to fight the fires. All of this is connected to climate change and these infectious diseases that we're dealing with. And there's a laundry list of other examples, if we had enough time, that we could go through.
In fact, a friend who writes about wildfires, Michael Kotis, is online, and I'm going to unmute him for a second. Michael, do you have anything to add to that about wildfires and the crossover with health? Putting you on the spot, you may not. All right, I'll take that as a no. All right, so what other sort of what we're seeing is, I think, what we're talking about is a lot of crossover, and these things can't be in isolation. And Mustafa, you touched on this, the idea that once things go back to normal, whatever normal becomes, and economic activity ramps up and more of this stuff is being spewed, it's the gases and the things that contribute to increase in temperatures to climate change, but it's also the thing that affects people's health. So there's a multiplier effect in all this, that as the pandemic ends and these other things begin, we're multiplying the effects once again on how this is going to be damaging people around the world. Does that fit well?
It does. And, you know, there are blueprints for us to move forward. If you are someone who supports the Green New Deal or the Blue New Deal, inside of those speaks to a pathway forward for us to be less fossil fuel dependent, on being able to create jobs, on being able to address the healthcare needs that are out there. So, you know, we have some opportunities to move forward. One of the most, and I don't easily get frustrated, one of the most frustrating situations right now is that we're not thinking critically about these stimulus dollars, you know, trillions of dollars that are moving. And in many, many instances, it's not forward thinking, forward looking with a strategy to better prepare us and to better create the structures that are necessary for us not to have to be in the same situation. So we need to have a stimulus bill that's actually focused on our most vulnerable communities, on communities of color, lower wealth communities, and indigenous populations. And if we're not doing that, then we have a very curious matter, because we have no problem and actually propping up corporations and industries. And there is value in that space. But, we give a few dollars for folks to put in their pockets, and we think that we've done what's necessary when we have an opportunity to actually, if we have real leadership, and hopefully leadership will evolve, but they have to do it extremely quickly to make sure that we're addressing building a true equality infrastructure system that protects everybody, and especially most vulnerable folks.
I hear about the stimulus dollars, and one of the things that is if you look at who's getting laid off, Black women are going to take a huge hit because often in the service area, especially in the low-wage service community, have been laid off, and women in general, but just not only women, but also Black women, and in small businesses. I think 96% of the small businesses that are Black owned only have, they're the only employer, they're the only person. And the stimulus dollars came down to employers to pay their employees. The problem of only person in your business is much more common in Black communities than it is in white communities. So again, with an equity lens, if that had been considered, the stimulus program would have had to address the need of how do you do the solo employee, independent contractor. My one little beautician, who is an independent contractor in a salon that she rents her chair, she's not going to benefit from the stimulus package. How is she going to continue her family? So there's so many issues that has happened that's unique to certain populations. And as much as we know pandemic is affecting everyone, just like climate change affects everyone, white, Black, Hispanic, Native American, everybody's going to be impacted by climate change, just like this pandemic. But there's certain populations, the low-income population, the elderly, children, and definitely the Black population, because we represent so much of the inequities, going to feel the brunt. And so policies and response has to take account of who these people are. So a stimulus package can't eliminate 96% of the single Black owned small business in America, which it has.
So I want to promote something that we did a week ago, and that's on the State of the Planet blog at the Earth Institute, which is a discussion very much about this, about the economy, which is also in a state of collapse right now. And instead of returning to the old normal, if we can design a new normal that will be more equitable and more just. So let's take a few minutes and then get to questions. Let's talk about.
Wait, can I add to that?
Yes, of course,
question?
please. Yep.
So I just want to add that we don't really have to wait to see what how climate is going to interact with COVID, because it's already happening. There's a cyclone in Fiji right now. There have been pretty bad floods in Latin America, off the Amazon. Jocelyn Timberley, I believe is her name, wrote a great story about that in Earther. We just haven't, and there's also been tornadoes here in the United States. How is climate going to interact with COVID? It's going to make it a lot worse. It's also going to add extra strain to the agencies that are already responding to COVID, because those disaster response agencies tend to be the same ones that would respond to a disaster. So what happened to folks suffering from those floods off the Amazon was that they had to wait for an extraordinarily long time for the government to pay any sort of attention to them, because all of their attention was on COVID. And at some point they're really going to collide in a way that we can't ignore. And that's probably what's going to be the story of Fiji's recovery. And unfortunately, there's always a million climate disasters happening in the global South that never really get coverage. So probably need to start doing a better job with that, just period.
All right, so can we expand on what Mustafa started talking about there, and let's spend a few minutes, and then we'll go to questions. A few minutes on the idea of how do we change? What are some of the? Are there any actions you can suggest right now that, especially Dr. Holder, because you're in the midst of that system, what could change right now? What number one thing would you do if you had that wand to affect change that would make a difference in the healthcare system moving forward?
Well, one of the biggest things I've seen is that I hear about Dr. Fauci, and the return of the respect of science and medicine, and understanding who your trusted leaders and trusted speakers who may be more likely to speak the truth. that will then protect your life. And I think that's a huge improvement in our society. And that's absolutely necessary for climate change because we have to start with understanding the information. Education may not be behavior, but it's a start. You've got to start from somewhere. So that's one of the biggest shifts. The equity lens is important as we craft policies. We've got to see what areas are more vulnerable, race, class, gender, all these things are important as we craft a response. So testing must be done. We have to know where the virus is. What type of testing? The dollar should flow for folks who do not have the housing, the transportation, economic factors to wait 4 or 5 days for a test result. I waited 12 days for my test result to come back. Had I lived in one of these communities, I would have infected, if I'd been positive, infected hundreds of people or my entire family. And my mother is 91 years old. So you imagine why certain procedures have to go for certain communities. Mobile testing, rapid testing, and then moving to track and contain. And we may have to have separate places for these people to go if they can't go back home. So the approach has to have an equity lens. We must test and we must educate with trusted advisors. Communities that don't speak English. We have a large Guatemalan that speaks a native language. The communication is very heavily dependent on mainstream media, English, and a middle-class structure. We know we use radio in much of my communities, but the radios, one of the big gospel radio stations in South Florida does not have a contract with our Department of Health to educate our elderly Black people who listen to it. One of the largest Haitian radios, their reach is only to a certain part and drops a large part of the Southern Haitians. And that's where people get the education message from. They don't get from watching CNN and MSNBC and Fox. So that's the issue. I see a three-pronged: educating, communicating, testing, containing, and tracking, and addressing it with an equity lens. And that's how I would characterize my response to COVID. And using the same structure, recognizing that we all get affected by any process, whether it's climate change or pandemic COVID. But the response has got to recognize the vulnerabilities within our society and work at a framework level to address it immediately and within a long-term lens. Thank
Mary?
you.
Some thoughts?
Yeah, I don't think I can actually add anything to that. I think Cheryl said it all.
Okay, Mustafa?
No, I agree with my esteemed colleague as well. You know, we've got to make sure that we're addressing the medically underserved areas. It's amazing that when we want to do something, we get it done. And I'm glad that they are. You know, we've got hospitals now popping up, you know, temporary hospitals, you know, so if we're able to do that in this very, very, you know, challenging moment, and again, I respect that that's happening. There's no reason that we have these medically underserved areas across the country where clinics and hospitals have been closing down, and lots of times in places where we haven't placed value on the lives that exist in those areas. One of the other things that we need to do is to make sure that we're addressing the homeless problem that we have in our country. 500,000 people, and that's the conservative number, are homeless in our country. So we've got to address this in the moment, making sure that we have, you know, mobile testing units that are going out to the locations where our homeless brothers and sisters are, making sure that we have portable sinks, making sure that we have portable showers so that folks can, you know, take advantage of personal hygiene. But we also, as was shared, we have to have the equity analysis, and we've got to also have the testing that's happening. And it needs to happen in the places that are often unseen and unheard.
All right, let's get to some questions. So don't forget to get to onlinequestions.org and get your questions in. A quick question from a journalist: going off of what we've been talking about as hurricane and wildfire seasons get close, Mustafa, what have you been hearing in Capitol Hill about FEMA capacity and priorities?
So a lot of the capacity has been not related to, you know, moving into this hurricane season that we're about to approach. I think that as journalists begin to highlight that and to reference some of the past impacts and how they will be exacerbated by the moment that we're in will be extremely helpful. Because if we don't, I mean, imagine the scene that you all remember when Katrina hit and we moved all those folks into the Superdome. Can you imagine a situation like that where we literally have all these people who are being displaced because their homes have been destroyed from wind and from water, and they have to go someplace? How do you deal with that situation if you're not thinking critically about the real possibility of that happening? So not enough attention has been brought yet on Capitol Hill. People have been struggling and sort of scrambling around and trying to address the immediate emergency without thinking about what literally is just around the turn.
I want to get at some of that too. The media has been criticized for years as being very elitist East Coast, and I can't disagree with that argument. But in a sense, if they don't cover the central part of the country, in a sense, it doesn't really hurt people. But you've identified and talked about people who are not underserved, but not served at all, who are not recognized. How do you build capacity? How do you begin to get a government that has the capacity to even see these people, to see these issues and see these problems? What do you do I mean, that's what we're talking about here. We're talking about systemic inability for these people to be seen. So how do we do that?
Let me chime into that real quick, since I spent a little bit of time in the government. When I left, I was the only senior advisor for environmental justice for the entire federal government. There were 17 federal agencies and departments underneath of the Obama administration that I helped lead. So when the president does not have anyone in his inner circle who has expertise, comes from these communities, has worked in these communities, then he's going to have blind spots, even if he cared. He has not necessarily, for me personally, shown that he has cared. So you've got to have those folks in there. They should be hiring folks who come from these communities, from these sets of work. And there are literally hundreds of geniuses who are extremely innovative. I don't know how many would necessarily work under this administration, but they would provide advice to the administration to help them to not make some very serious and deadly mistakes. And just let me add one other component to what we're talking about, because we've been talking about wildfires, we've been talking about the hurricanes, and of course there's flooding that's associated with that. And we haven't talked about what will happen when we deal with these extreme heat events. If you go to large parts of our country, especially as you get into the Black Belt and other locations in the South, and if we have these, as anticipated, 100+ days of temperature, how do you shelter in place? How do you quarantine yourself in your home if you don't have air conditioning? So people are naturally going to have to try to escape the heat. So this administration and the governmental administrations on the state level need to be thinking critically about these challenges, which are literally just a couple of months away, and how they're going to address them. So you can't do what you traditionally do and say that you're going to send people to cooling centers, because that means that you're still going to have a large amount of people who are in a singular location. And unfortunately, I just don't hear enough people thinking or talking critically about these sets of challenges. And we need this administration in their stimulus activities and other activities to start to address these, to these really serious challenges before they happen. And it could show that, they did not get in front of COVID-19, even though they had the knowledge and folks had shared with them way beforehand. Now, if the journalists who are listening on this call begin to talk about this, they can't say they didn't know.
And of course, heat is a stressor for all these other underlying conditions that we've been talking about throughout today. You were in the Obama administration. Was he doing it in a way that you thought was successful, or at least had a pathway?
I believe in real talk. There's never been any administration that rose to the level that I had expected them to. I do give credit to President Obama, because he got an environmental justice memorandum out, executive order. He also helped to support some of the interagency working group work, and did a couple of other things. But we're in a new time now. We're in a time where young people are demanding climate justice and environmental justice. It is now a part of the lexicon. It is no longer something that we have to prove the impacts that are happening inside of communities, and also what's happening today and in the tomorrow in relationship to the climate emergency that we're facing. So any administration that comes into power, whomever the next one may be, will have to address these issues. And on the Democratic side, all of the candidates, some better than others, have talked about and have built platforms and white papers and strategies about how they will address these issues. And we've just got to continue to hold people accountable and push.
And these questions apply internationally as well. But so Mary, Cheryl, Mustafa talked about building capacity at a national level. How do you build a capacity, a lens through which those who are not seen can be seen now? How does that happen? That's such a big question here.
I think for us, South Florida, and what we've been doing as physicians, it's going to be grassroots. And I think we've seen COVID bring out something that I've never heard anybody say. A frontline worker, and remember the delivery driver, the pizza delivery driver, and the UPS driver, and the environmental worker. Actually, have folks who have recognized that they exist. And I think we got to build on this movement to say that who are the frontline, who are the vulnerable, so that it's easy to transfer this knowledge over to climate action. And the vote is coming in November. And I was speaking to some of my son's younger friends. I say, if there's anything that's going to impact you even more than climate change that impacted you now, climate change is even worse. And right now, the millennials are hurt again with this economic downturn, just when they're about to come back out from the 2008 devastation. But they've got to step up and vote. So how do we do it? We now have to work on the grassroots level. We are developing connections to get this word out about COVID quickly in this population that are very vulnerable, and develop those connections and then use them for the climate message. Because I have been able to get a group of the Urban League, the Black physicians, the Black nurses, the Haitian doctors. We're coming together right now in South Florida to try and save our communities. And I'm hoping we're going to stay with that connection to then take it to the next level of pandemic. And I see it online. I see it on the internet. I see what's her name? Cardi B talking about coronavirus. Can you imagine Cardi B talking about climate change? We have seen a movement here of baseline regular folks taking on an issue of COVID, educating each other, wash your hands, do this, do that, coming up with their own videos. I see a tremendous opportunity right now based on this movement that we're developing with COVID to take us to the next level. So I'm very optimistic about our climate challenge, where before it was just a small group of folks. We are developing networks and connections, and even this, we could take this to the next level for climate change. So I'm very optimistic on that. And I say vote. And
well,
never.
And I know you're not saying that you're absolving government from this responsibility, but what it sounds like you're saying is individual capacity. Let's build this capacity outside that system. Is that what you're saying?
That's the only way. Government responds to the people. So if we don't get ourselves as a coordinated voice to say we want change,
okay,
we're not going to see the vote reflected in November. So I want us to use this leverage, this connection as we're getting more connected. I'm on a call as a physician with non-physicians. In the past, it would be a physician conference and a journalist conference and this conference. And with COVID, we see this intersection. And I think this is fabulous, but we need to build on this and take it to then turn it into policy, because policy is what we need to make that change. We can't make any improvements in our lives without the policy. And that means we work our politics within the grassroots to leverage all those voices and unified voice to say we want to change in November. That's how I see it.
Mary, anything to add here?
I guess, so the original question is, how do we build
capacity building to see, so people are seeing, yeah.
So I guess I'm struggling with that question because it kind of, to my ear, sounds like, why can't journalists see the humanity of people of color? And I don't know. I honestly don't know.
I'm not talking, we were talking about capacity within government to provide these services. So I was talking specifically within government, but that's okay. Well,
it sounded to me like a storytelling question, like why are the stories and narratives of people of color not being told? And to answer that, like, I think is an inability to see humanity, and I don't know why. And as far as how to reshape government, I'm honestly not comfortable commenting because I've never worked in government, and I don't really know a lot about how those systems work together.
Well, that's fair enough. So there's a question that I thought of earlier and I forgot to ask that I want to get back to, and we're talking about COVID specifically. We've already talked about underserved populations, less healthcare in rural areas, in poor communities, and what we have is a virus that is wiping out a healthcare population that has already been stretched thin. I mean, we were having crises in some areas of not enough doctors, not enough dentists, not enough therapists, and it's only going to get more severe because some of them are dying. Dr. Holder, this is your field. Your thoughts about this, and are you concerned about the state of the health system moving forward? Just from a human being standpoint, will there be enough people to get people into these populations?
Absolutely. We already know the data. Underserved populations have fewer physicians. Black physicians, there are about 55,000 of us nationwide of the 1 point something million active. So when we lose one or two, and we've lost several already, you're losing a large percentage. So often I say, if there's an equity message about that, is how do we get PPEs to protect the few Black physicians that are out there? The recognizing our value, it's not so much that Black is better, but we work in getting health outcomes that surpasses other groups. So then why is it not that we do not have a way of protecting us economically? Because at the end, will Black physicians be able to be employed? Will they be able to keep their practices going? Will we even stay alive? So as a Black physician, we're acutely aware of the impact on us. As an overall human being, there's no reason this social contract that we made as physicians made us go out to slaughter. So there's been a fall in that social contract that as physicians, we do everything possible. That's why we're professionals, but then the society should do everything possible to get us PPEs. There shouldn't have been a bidding war. There shouldn't have been any fighting over whether it was right or wrong or whether somebody's stealing. There should have been the responsibility of society to say, protect the folks that you spend $2 million to educate, prepare to go out and take care of you. So yes, we are concerned that at the end, we're not going to have enough doctors or nurses or environmental workers or respiratory therapists. And then how do we prepare for the next one? Because it takes several years to prepare at this level of professionals to be able to care for you. And so you're looking at, again, the most vulnerable. Physicians are just another metaphor of what we're talking about with poor Black people. Physicians on the front are incredibly vulnerable. So how do you protect the most vulnerable so they can contribute to the society? And I say that for poor Black people, poor Hispanic, for everyone. We're all equal, but the vulnerable needs extra protection so that we can continue to contribute and make a huge difference and make all of our lives better. So yes, physicians, especially Black physicians, are scared because we often work in those same cities, in those same institutions where all the sickest are coming in and we are dying. I know my ex-husband who works at Harlem Hospital is now in ICU fighting COVID pneumonia, and he dedicated his life to the poor community of Harlem for 30 years. And he's paying a price. Why couldn't we have had more equipment right up front? So yes, it's real and we do have to protect, but it's the same lens of who's the most vulnerable and how do we mobilize our resources to help the vulnerable as much as we help the others.
I'm very sorry to hear that. Okay, so let's go back to some of the questions, but a quick comment from someone. For those of you in communication with individuals who have minimal or no internet access, companies like AT&T and Xfinity have been opening up free Wi-Fi hotspots. I've not heard that, so if that's happening, that might be something that as journalists you can check your communities and see if that's something available, and if not, ask why not. What type of structural solution-focused stories can journalists cover now to address the compounding of complex issues due to COVID-19? We've been talking about some of that, But do you have any other thoughts on structural solution focused stories that journalists can look at now to address the compounding of the complex issues brought on by COVID?
My insurance, access to health. It's not enough just to pay for the insurance of those who are affected by COVID with proven studies and hospital costs. There are a lot of costs to folks. So we need to have health care, health insurance, access to health care for the poorest, for the poor people who are 80 million uninsured. We need to address that structurally. Short term, there's so many ways to get health care. When you tell me call your doctor and find out if your symptoms are COVID, when we know such a large percentage of the people I treat have no doctors to call, that's just not recognizing the understanding of the structural barriers in our society.
Yeah. And this is Mustafa. So, folks have heard me talk about the Regenesis project that we have in Spartan, South Carolina, and we're launching a Revitalizing Vulnerable Community Institute. And it's so critically important in this moment because there in Spartanburg, they had health deserts where people had lack of access to health care. They had transportation justice related issues. They had food justice issues. They had lack of jobs. And inadequate housing. They had old shotgun housing. So, there we've been able to, move people out of the old energy inefficient housing where people were paying $300 to $400 a month for electricity costs. And we got 500 new green homes in that are healthy and safe. We got, new community centers. We got 5 new healthcare centers in the area and a mobile healthcare unit that actually goes out to folks who can't make it. To one of the other centers, and it's creating jobs at the same time. And it's also helping the migrant population who was scared to actually go to any of the existing facilities because they were afraid of ICE and some of the other, just terrible actions that the country has been moving forward on over the last few years. So what you've got to do is you've got to actually rebuild the infrastructure inside of these communities. And this is just one example of how community folks are taking the lead and building, and helping their communities move from surviving to thriving. So we need to highlight those examples. The Environmental Health Coalition in San Diego is doing some incredible work. The work of Miss Margaret May in Kansas City and the Ivanhoe community is also doing some incredible work. All of it ties into the moment that we're in because it's about helping people to have access, helping their voices to be stronger, helping to make sure that the infrastructure is underneath of them. And as our doctor had shared with us earlier, also helping people to get engaged in the civic process to understand how their vote can make real change happen inside of communities. So we need to be elevating those stories that are helping to bring healthcare, jobs, infrastructure, and a number of other elements together to show that people have power.
So I'm just writing a quick note because I think, I have this resilience journalism program that I run, and resilience is about systems thinking. And what we keep coming back to is that it's systems. It's not any one thing. It's healthcare, jobs, infrastructure. All these things combined can make a big difference. At least that's what I hear you saying.
Yeah, and if I could just let me just add one other thing that for many of the reporters will help you with your editors. There in Spartanburg, they took a $20,000 environmental justice small grant and have leveraged it to over $300 million in changes. So that should get your editor at least interested in the overall concept.
And Dr. Holder?
Yeah, I'm not sure if it's structural or not, but I think the concept of health has got to be expanded in this country and understand that the health is not, because I see it already in shifting the blame of what happened with COVID outcomes based because, oh, you're diabetic and you're too big and you're too this. I even heard it from a senator, what state he was in. He's one of the physician senators who kept talking about the angiotensin enzyme in receptors are so high in diabetics, and that's why we see the blacks are falling. And I think if I had taken those same patients with diabetes, high blood pressure, smokers, and put them in a rich person's home who I know has no COVID, stayed out at the time, would they get COVID? No. So we cannot separate what happens physically from the social determinants where you live, where you work, where you play, all the access to money and power and politics in impacting health. So as we expand our definition of what causes ill health and why is my patient sick, and not say my patient happens to have a lot of receptors, so the COVID bound, and they just happen to be diabetic, and they just happen to be fat, and they just happen to be Black, and that's why. We have, all of us have responsibility to expand the concept of what keeps us well. And it's genetics and factors about 20–30% of what keeps you well. And until we address with all the other factors, we're not going to get there. So I don't know if that's structurally in our minds. I'm Jamaican. We always talk about, Bob always comes back, emancipate yourself from mental slavery. We do have to change how we see health. And until we accept that health is not just what happens to me physically, but where I live, where I grow, we are not going to address the changes that are needed. And that's one huge structural thing that we've got to change.
And I see a note from Francis. Thanks for the camera shot there about using stimulus money to rebuild old schools in poor communities as well. Let's get to a couple other quick questions. I'm going to ask all three of you for just a minute of parting thoughts in just a few seconds. So if you could think about that. But someone is asking if we can, and I don't know that there's much of a question in here, and we've touched on some of this, but can someone address the role of home healthcare workers? Seems they're on the front lines of helping people with both COVID and climate change, yet they're poorly paid and often as vulnerable as the people they care for. Anybody want to address that?
We're addressing it in one of our actions that we're trying to meet with the governor here, because so many of the home health workers in South Florida are the newest immigrants. That means they're the Haitians, they're the Jamaicans, the Hispanics, and usually women or women. And so they often don't have access to masks and any of the protection and the education. So we are looking at it again, it's a vulnerable population. So we want folks to realize, let's identify the vulnerable groups, let's find solutions and protect the vulnerable groups. Because yes, we're all in it, but there's some that are more impacted than others, and who are those? So definitely spread the word about that population. And there's lots of GoFundMe and different campaigns out there. Churches are out there. Get with those groups to get the equipment to that population.
A question about the administration. In your view, how much damage has been done to the healthcare system by the Trump administration with their limiting access to the healthcare exchange and the general problems associated with the coronavirus? And I would add the reluctance to open the exchanges for more people to enroll at this point. Mustafa, you want to talk about that?
I mean, you know, it's very apparent, you know, there are attacks, you know, on what some folks have called as Obamacare have been relentless, which has continued to weaken our structure. People talked about the healthcare exchanges, you know, actions on both the state and federal level to weaken the opportunities for people to fully participate in that process. You know, the cutting of funding, whether for HHS or CDC, or a number of our departments and agencies have also played a huge role in this moment. You know, and I even bring FEMA into that conversation because they may not necessarily be a medical, you know, agency or body, but they play a critical role in supporting what's happening in that space, especially as disasters happen. So, you know, the administration, in the words of my grandmother, when you know better, do better. And they have refused consistently to actually do better in this space. And they've actually, you know, made more people vulnerable and made more people's lives, you know, placed the crosshair on them.
There's more to add. It's very clear the administration has supported the public-private partnership concept and just want to expand to poorer people. And the only thing we can really imagine again is this, that because more people who have never previously experienced this will start experiencing this uninsured position, we may see a now movement to understand fully. Most of the US got insurance through employers, so they've never really understood when we were pushing for universal coverage or pushing for expansion of Medicaid, because it really never impacted them. And unfortunately, until it hurts you, you often don't wake up. So again, this is an opportunity to explain our health systems better to the folks who are now going to start participating in the safety net system, never having done that before.
Mary, anything you want to add? Hang on here, let me unmute you, hang on. Oops, you're not unmuting for some reason. There we go.
Okay, does that work?
Yep, sorry about that. Yep.
Okay. Yeah, I just wanted to pick back up on this idea of, undocumented and uninsured people as being, just a major problem that I'm not seeing covered all that much, because those are a lot of the people who are preparing our food and working in grocery stores, et cetera. So it's not only a health issue for them, which is bad enough, it's a health issue for everyone else who's depending on them and depending on their labor. So I think, yeah, that's a structural area I'd like to see more conversation on.
I wanted to, someone had tangentially mentioned this in the questions too, and I want to throw this out, the idea of transportation. And Cheryl, you talked about this as well, but the stories out of New York, I had to be down there 3 weeks ago and was in the subway systems on the west side, and all the stations were empty. But those areas where the folks who are underemployed or desperate for a job, those stations are filled with people. They're packed as they try to get to their workplaces because they don't have transportation. And I think that's something journalists can look at in any city around the world as the issue of transportation. As you mentioned, getting to healthcare, getting to a doctor. Heat is a factor for some of these other underlying causes that we've talked about. And when it's hot and you have to walk a distance to see someone, that exacerbates the problems you're facing. But the transportation issue, I think, is a big one. We have I'm really excited to see a journalism student or a journalist student asking a question, and curious your thoughts. Let's use this as the last one, and then we'll ask for some final thoughts from all of you. Students face inevitably complex situations, economic, race, and other, but how can we best cover their stories without forgetting or overemphasizing certain factors? And this is a big issue. We've got smaller and smaller news holes, and they're writing more complex stories. So journalists tend to narrow down into one point, but life isn't like that. As this whole discussion has been about, life is complex. There's systems interwoven. So how can none of you may have a good answer to this, but how can you begin to address these complex issues in a way that does them justice, I guess?
I can speak on what I see younger people, and especially our medical students, that they're using media. Those little Instagram stories are often what I guess human interest stories of the old time days in the print media. So I see young people having an opportunity to use this new media to still tell those stories. There's a group, Sean King with North Star. He has like 1 million followers or more. He sort of quasi-journalism politics. I'm not sure what you describe his thing, but there are lots of opportunities for the young folks. And just because you may be physically able as a percentage to withstand COVID, it doesn't mean the harm and the impact, the mental health issues, the struggles that younger people are not equally important to tell that story, especially when it comes again to marginalized populations. So I see an opportunity for young people to get in here, using new media, telling their stories, because the impact is real, because many young people may end up being the ones to support their families who have been impacted by COVID. If their parents went down, their grandparents went down. So we do need to have young people use it and get the word out.
Mary, I don't know how large your following is. I'm assuming I suspect it's pretty big. Do you find the medium, no pun intended, but the medium of essay as an easier way of addressing complexity? I mean, you when you read your essays, they're very straightforward, simple points, but you're addressing very complex issues. It's a style of writing that you have that's a great communication tool. But do you find essay as a way of better communicating the complexity we're talking about?
Sometimes, yeah, I think that it depends on what you want to say and how much you need to process to say it. At least that's how it works for me. I often make complicated points on Twitter. I often make complicated points speaking in person. But it depends on, like, I picked up writing as a kid because I got sick of being interrupted. So when you write an essay, nobody gets to interrupt you. There's no like a million comments, saying, well, you forgot this point. It's like I was getting to it in the next tweet, but you interrupted me. So yeah, it depends on how long you need to say what you need to say, but you can also make some points on Twitter. A lot of my essays have been born out of, and they're basically belated comebacks to something someone asked me on a panel and I couldn't think of the right words at the time. So 3 o'clock in the morning, I wake up and write it. And the same can happen on Twitter too.
Do you have any tips on how to be complex in a tweet? How to have depth?
It comes to me naturally. I don't know. Be Southern. Learn how to be real quippy and come up with all sorts of metaphors if you grew up in Alabama and Mississippi. And if you didn't do that, I don't know how to help you.
So just follow you so you can get some ideas of how to do it.
Or maybe find your medium. Everybody doesn't need to be like, great on Twitter or great on essays. People have different skills. We don't all need to do all things.
All right, so let's we're closing in on our time here. Let's wrap up. If I could ask if you have any, you don't necessarily need to, but if you have any last closing thoughts, Mustafa, I want to, if I could, I'll send you a note to jog you. You mentioned a lot of projects around the country, different projects. You mentioned San Diego, some other places. I'd love to get just the names of them. I'll look up links and put those on our page too, so journalists can say, here's something I can look at and here's an idea I can write about. But do you have any last comments? Why don't we start with you?
No, we just got to help our most vulnerable communities move from surviving to thriving. We do that in a number of ways. We talked about how important voting is. So we've got to protect that democratic process. We got to make sure, that all these barriers that people are trying to put in place from people being able to effectively engage in civic engagement during, this pandemic, that we just don't allow those to happen. We also, and I got to give a shout out to the Hip Hop Caucus where I was for a couple of years. We've got to make sure that our artists and entertainers have the opportunity and the space to fully engage in these conversations and the solutions. Our activists and our artivists don't need to just do PSAs. Lots of times people want to approach them for that, and there's some value in that, but they have so many other skills. But lots of times we just don't invite them in and link them up with, both the scientific and legal information that can help their message to have, even a stronger foundation. So that has to be a part of the process. And as we've said earlier, there has to begin to be an equity analysis and environmental justice analysis for all of these program policies and activities that people are moving forward on both the federal, the state, and the local level. And if we're not willing to do that, then we're going to continue to leave gaps in the process that are going to cost people their lives.
Great. Mary, I'll give you the last word. Dr. Holder, do you have some last thoughts?
Just what all the speakers have said, and I closed in my op-ed piece. I said, viruses do not discriminate. Taking care of vulnerable populations is taking care of ourselves. So this pandemic, just like change, is impacting all of us. And as we take care of the vulnerable, we're taking care of ourselves. And hopefully, as Mary talked about finding humanity, it does come down to understanding that we're all in it together. We're all suffering in many ways, but there's some that are more vulnerable, and taking care of them is taking care of ourselves. Thank you.
Great, thank you. And Mary?
Yeah, I think with this story, we've done a very good job of doing what Mr. Rogers told us all to do, which is, look for the helpers. There's always someone helping. But in this story, I think that we also need to look for who's hurting. And what we'll probably find, and what I found, is that the people who are helping and the people who are hurting are the same people. And so making those connections clearer. I also think we need to look for the people who are hurt, who are doing the hurting, who are doing the actual harm, and tell those stories honestly. One of the things that I've been really interested to see more about is how COVID is playing into ecofascism, which is on the rise here and internationally, and how it's going to be used against people. There was a run on guns right before this. Well, who bought them? Who were they planning to use them against? We're now having to wear face masks outside. And as a Black person, I'm very scared to do that. And it's, we've been punished for doing such things. So what happens when we're more heavily policed for leaving our homes and violating social distancing guidelines? And how does that play into gunshot wounds and police beating you up? Like, that's a health concern too. And so I think we need to look at all of these reverberations. And also, this is as much a mental health crisis as it is anything else. And more stories about domestic violence and all sorts of other types of violence, and how it gets more unsafe to walk outside as a single woman, because now there's fewer people outside, and also people are just agitated and irritated. So just telling a fuller story about who's being harmed and who's harming them.
These are all good words. I'm sorry we have to end, but I want to thank you all, Mustafa Ali, Mary Hegler, Dr. Cheryl Holder. Thank you so much for all of your insights today. It's been immensely valuable to me, and I'm sure to everybody who's been watching. The discussion does not end now. As soon as we get the video edited and a blog post written, all of this will appear on the Earth Institute blog. That's blogs.ei.columbia.edu. blogs.ei.columbia.edu. In addition, the video will have a list of resources for journalists and anyone else interested in this topic, and we'll have some story ideas. These will be entry points to coverage for journalists. We've talked about many of them today. I hope you'll visit the blog later this week for all this additional information. My thanks. One other thought is, if we have other questions outstanding on that list, I will ask them if they could do quick responses that we can also post. My thanks to everyone at the Earth Institute who supports this work, and thanks to all of you for joining us. So long from upstate New York. Have a wonderful day.
It's been great. Thanks, everybody.
Thank you. Stay safe. Stay home.
Thank you.
Bye-bye.
Bye-bye now.
Bye-bye.
Bye-bye.